I am Professor Dr. Vivek Gupta from Delhi Indraprastha Apollo Hospital, 5th of December 2021, Sunday, almost noon or afternoon. We have seen a very high level of scientific program during the Cardiological Society of India meeting. This is CSI TV, and also I represent the chair as a chairman of Indo, American and European Conclave. Today I am going to talk about, because this is a time of COVID, and after 2 years of hiatus, we are having a hybrid and physical meeting both. So what I am going to talk about is, as a cardiologist, what cardiac patients or heart patients should do during the COVID time. You see, the COVID coronavirus disease, which came from Wuhan, first case came in something like early January 2020, and Honorable Prime Minister made a lockdown of India on 24th March 2020. We are talking of last year. We are now at the end of 2021. It's almost 2 years we have been suffering, and the data which came up during the time, because it was early stage, it was just a viral fever. But when the viral fever, which was found to have a high mortality, we were all scared. The whole world community, including WHO, was very scared that how to deal with the new virus, which is coronavirus. Lot of acquisition went to the China, why Wuhan laboratory allowed this virus to escape, whether it was a biological war or not. We are not going to details of that. We have crossed wave 1 in India. Our lockdown started in June 2020, last year, and after that we had some slow COVID wave during the time of last year Diwali, and then New Year, and then till Holi we were all right. And that time we had WHO had already given 2-3 more mutations, alpha, beta, gamma. But then a new virus came, which was Delta. And Delta virus, which was seen to be more disastrous, more virulent and more contagious. That means it has got a high power of infecting more people, and it has high power of causing early pneumonia and deaths. Earlier in wave 1, where alpha, beta and gamma virus were doing, that means not very highly mutant virus, those virus was causing high mortality, but not to the extent of what Delta virus did in wave 2. Cardiac patients were more vulnerable. It was found in the initial stages when we were doing webinar, early stages of webinar during the COVID wave 1. And we found that the mortality was directly related to the morbidity. That means the patients which were cancer patients, patients who had a low immunity, heart patients, hypertension, diabetes, past history of bypass surgery, past history of angioplasty, all these patients had a higher mortality. Mortality means chances of death, and that was found to be about 8 to 10%, which was significantly very high actually, and especially the elderly age group of the cardiac patients were more vulnerable to death and mortality. So that was the reason why the cardiac patients were very. And secondly, at the same time, we discovered, the whole world community, medical community discovered actually the cause of death was not only pneumonia, but also it was thrombogenic potential of the virus. That means it causes coagulation or blood clotting inside the veins, especially in the legs, which goes into the in the lungs. At the same time, the autopsy report showed, in Italy especially, that it was microvascular thrombosis which was responsible for high level of pneumonia and acute respiratory distress syndrome. And this was found to be pretty high, especially in cardiac patients. And this is a dichotomy, because on one hand, most of the cardiac patients are on antiplatelet medicines. They're on aspirin or clopidogrel or combined together, or maybe one of them. And despite that, the high mortality in patients of cardiac disease was found and discovered during wave 1. What could be the cause? The cause was that they had a lower immunity. Most 30% of the heart patients were having diabetes. And secondly, they were little more elderly and low immunity, and therefore the innate body immunity to fight against the virus was less or lacking. And that is why children were not suffering that much as elderly, and especially with the comorbidity of heart disease. So now we are passing through, we have crossed the stage of wave 2. Today we are having a new virus, Omicron, which has got the 32 mutations on the spike protein, and there are a lot of thought process whether this is going to have a immune escape especially with the vaccine escape. That means now at the moment in India 40 crore population is having a dual and vaccination, while 70 crore is about single vaccination. So as of now 110 crore population of India is already vaccinated. About the rest of the population, which are children less than 18 years, are still not vaccinated. That means the vaccination has not yet started in the community of people less than 18 years of age in India. Omicron, the new virus, is having 32 mutations on the spike protein, and this has come from South Africa. In India today at 5th December 2021, there are about 5 to 7 cases. The biogenomic analysis has confirmed Omicron virus. But it has been almost 1 month. I was just now talking on TV9 Bharatvarsh that 4th November was the first case discovered in South Africa, and there has been constant travelling from South Africa to Europe and from Europe to India. Despite that, we have not seen a surge in the number of cases in India. Today, as of now, we have about 8,000 to 9,000 per day, which is quite stable number of cases despite high level of testing. Despite high level of testing, the number of cases of COVID has not gone up drastically, rather they are stabilized at around 8 to 9,000 per day. So what is the message? I feel that Omicron virus, although it has come to India, it's not only 4 cases, must be more than 1,000 cases. Why I am saying so? Because we are not subjecting all the cases of COVID for biogenomic analysis. It's not possible to do it. So my view is that in India, because of two reasons, the number of cases have not gone up so much. The reason is very simple. Although at the same time in Germany and Italy and France and UK, the number of cases have gone up. So India, we are protected more because of two reasons. One is the large population is already infected. Especially in wave 2, we had about 4 lakhs cases, 400,000 cases per day coming, and that continued for 2 months constantly, approximately. And we were feeling that, in fact, the actual number of cases which were coming per day was much more than 4 lakhs. So large population of India is already infected. I presume as a doctor that the patients who are already infected have a higher immunity level against this Omicron virus as compared to vaccination. Of course, vaccination is one weapon, but those patients who have already got infected, they are already protected. So this is the reason why the number of cases per day has not gone up despite 1 month, almost 1 month since the Omicron virus was first detected in South Africa. So this is a positive point. Second point is what cardiac patients should do. Cardiology is a very difficult branch, and in fact, I must confess that we lose a lot of patients. They die in the hospital despite doing the best of treatment. This could be post-bypass surgery. This could be because of the heart failure, because a lot of patients who have got low ejection fraction, heart failure means poor pumping function of the heart, they have a sometime intractable arrhythmias. And recently we lost a young patient who was post-surgical, post-VSD repair, and operated about 10 years back, and viral myocarditis, whether it was COVID or not, although COVID was negative, but viral myocarditis led to increased arrhythmias and multiple DC shocks, and we lost despite the best treatment in our hospital. So that's another thing. So cardiology is a very special branch. Cardiac patients are very special patients. They have to continue their medicines regularly. They cannot even one day, they should not stop their medicines because heart attack can happen. So this coronavirus has, for cardiology patient, let me tell you, there are 3 points. One, they should continue medicines regularly. Why? Because the COVID virus has got an increased thrombogenic potential. And therefore, the patient who is a cardiac patient, which has about 30% blockage, if there is a clot forms in the artery, that will lead to acute heart attack and the patient can die. So they have to continue regular medicines, they have to do regular checkups, they have to follow more frequently with their cardiologist, and of course, wherever deemed necessary, whenever advised by the physician or cardiologist, they should take up angiography as early as possible so that a blockage which is 70-80% can be treated with the help of stent. If not, if there is a blockage which is less than 50%, the patient normally goes for medicines alone, no stent, no bypass surgery. But during COVID time, this is a high time that all the cardiology patients, heart patients who have the history of heart disease should do regular consultations with their cardiologist, and they should specifically ask, do I need an angiography? If the physician, then he will tick and see the papers and documents, he will ask few more questions, and if required, do the angiography. Of course, continuation of medicine is important. Secondly, I am talking to the patients, last point, the patients whose family have suffered from heart disease. For example, a patient father, mother, brother, sister who has already had heart disease and they are healthy at the moment, they should do also regular checkup during COVID time. So this RT-PCR is not enough, rapid antigen is not enough, COVID appropriate behavior is not enough for the patients, for the people who has a high family history or strong family history of coronary artery disease like angina and heart attack. They should specifically do treadmill test, echocardiography, and very important, CT coronary angiography, so that they can discover even minor blockages which will be missed. I repeat, minor blockages will be missed by treadmill test and echocardiography and ECG. That means a 50% blockage will have a normal ECG, 50% blockage will have a normal TMT, 50% blockage will have a normal echocardiography, and the patient will feel happy. So if there is a strong family history, or if there is a small, even a family history of heart disease in any family member, they should go for CT coronary angio. But in COVID time, I repeat and I request all the physicians to take care of the family of the patients by telling them that if you are more than 40 years age, if you have even one risk factor like hypertension, diabetes, high cholesterol, smoking, or bad lifestyle, or stress, lack of sleep, please do, I repeat, diabetes, hypertension, smoking, lack of sleep, mental stress, family history. Please do CT coronary angiography, especially during COVID time, to discover that if you have 30% blockage, you start the treatment at least, because we don't want to miss a 30% blockage devoid of aspirin medicine, which is a blood thinner, and a statin, which is also this is anti-cholesterol medicine, which helps in reducing the plaque. I finalize my talk that cardiac patients should be taking good medicines, regular follow-up, family history. Those patients who do not have angina should do CT coronary angiography, especially during COVID time, because there is a rapid possibility that you suffer from COVID and you end up with heart attack. Thank you very much. Professor Dr. Vivek Gupta from Delhi Apollo Hospital, Chairman of Indo-American European Conclave, talking on CSI TV on last day of Cardiological Society of India meeting in December 5th, 2021, Sunday afternoon. Thank you very much. Bye-bye.